This case study is looking at patients who have received a cardiac transplant. So there's approximately 4,000 cardiac transplants performed yearly. The range is anywhere from 3,000 to 5,000, so that 4,000 number is just about an average. The average life expectancy after the transplant is 9.16 years, which is a significant improvement over the life expectancy if patients did not receive a transplant. And the patient survival rate 1 year after transplant, which is really important when you're looking at transplants, due to the possibility of organ rejection, is 85%, which is a pretty great number. So cardiac transplants are performed when other treatments for heart conditions have not worked and have led to end-stage heart failure. End-stage heart failure is a disease in which the heart muscle is severely failing in its attempt to pump blood through the body. End-stage heart failure is the final stage of heart failure. Conditions that can cause end-stage heart failure are listed below: coronary heart disease, amyloidosis, and ventricular arrhythmias. In children, transplants are usually performed because of heart failure caused by a heart defect or cardiomyopathy, and donor hearts are matched to the recipient by blood type and body size, so you don't want to have somebody, big person, getting a small heart. So the cardiac transplant surgery takes several hours, and if the person has had previous heart surgery, stents put in, what have you, it becomes more complicated, and the procedure will take even longer. During the surgery, the patients are placed on a cardiopulmonary machine to allow blood to continue to pump throughout the body. In real simple terms, the doctor basically just removes the diseased heart and sews in the donor heart. Once the new heart is in place, the surgeon connects the blood vessels to the new heart, and the patient is removed from the cardiopulmonary machine, which allows the new heart to start doing its job in the new body. So common medications prescribed to cardiac transplant patients are immunosuppressants. All transplants patients are prescribed immunosuppressants to prevent organ rejection. What happens with transplant patients, if they're not on immunosuppression, the body actually thinks that the donor organ is a foreign invader, so it actually starts to attack it. The benefits of exercise post-transplant: increased maximum heart rate, reduced resting and sub-max exercise blood pressure. We see an increased peak VO2 between 15 and 30% for a person that's been in an exercise program for 2 to 6 months. You see an increased bone mineral count, a reduced body fat mass, improved skeletal muscle strength, and aerobic exercise has been found to improve mitochondrial oxidative capacity, and both aerobic and resistance training have been helpful in managing the side effects of immunosuppressants. So the risk involved with performing exercise after transplant is big one is you don't want to be doing any upper body range of motion or resistance exercises until after 12 weeks post-surgery, due to the incision from about your sternum to your belly button, and the ribs and the sternum needing to heal from the surgery itself. Now, the other big risk is that immunosuppressants can prevent or can lead to bone loss, hypertension, diabetes. So patients should be carefully monitored for these conditions, and you really want to start off easy with resistance exercises. And any like treadmill exercises you do, because of the bone loss, you don't want to go too heavy or start at too high of an intensity and then lead to fractures or what have you. So the exercise response in patients post-transplant, we're going to see a slightly lower than normal peak heart rate of approximately 150 beats per minute. We're going to see peak exercise blood pressure is going to be slightly lower compared to non-cardiac transplant patients. And we're going to see an impaired left ventricle function. We're going to see an increased cardiac output due to, at first, increased stroke volume. And then later on in exercise, the heart rate increase is due to the increased cardiac output is due to an increased heart rate. We'll see a decreased exercising heart rate. And then the heart rate is a lot slower to return to pre-exercising levels compared to non-cardiac transplant patients. So exercise modifications for patients post-transplant, upper body exercises and range of motion resistance exercises should be refrained from until 12 weeks post-surgery to allow for total sternal recovery, both internally and externally. And then we should have continuous monitoring of the ECG during the first few supervised exercise trainings, just due to the fact that it's usually a couple days post-surgery, so we want to make sure that the heart is doing its job properly and performing the way that we need it to. So our patient is Mr. CC. He's age of 57. He weighs 210 pounds, a height of 72 inches, so 6 foot even, a BMI of 28.5, which puts him in the overweight category. He's been diagnosed with coronary heart disease. He is 12 weeks post-cardiac transplant. And he has been engaging in an outpatient cardiac rehab since his discharge from the hospital. Now, he's at that 12 weeks post-transplant. So this exercise program is for him to be able to start incorporating some of that upper body exercise. Also, it's recommended that you stay within the close vicinity of your transplant center for about 3 months after transplant, which he's at the back end of that right now. So the testing and the programming that we're developing for him is for him to be able to go out and do his program back at his home. It would still be recommended that he works with either a personal trainer that's familiar with his condition and familiar with patients like him that have had similar conditions to him, or a certified exercise physiologist would be great as well. So his exercise testing, we're going to put him through a modified Naughton treadmill protocol. You don't necessarily have to do exercise testing when you're beginning your outpatient program post transplant surgery. But at this point, since he's about that 3 months removed from the surgery, we want to see what types of improvements he has made in his program since he's been in his outpatient work near his transplant center. And the Naughton treadmill protocol, the modified Naughton treadmill protocol, is the protocol that the ACSM recommends to measure his cardiovascular fitness. So then we can base cardiovascular fitness goals off of those numbers. We're going to put him through a hand grip dynamometer test. Since he's just at that 12 weeks, we don't want to put him through a 1RM bench press test. And looking at his age also, we don't really want to be 57 is still young, but we don't want to be 57 and having a heart transplant is a different discussion. So we don't really want to be putting a lot of strain on him. And this is going to be some of the first upper body range of motion exercises and resistance exercise he'll be doing since he's at that 12-week post-transplant timeline. For his muscle endurance, we're going to be looking at a 50% max hand grip dynamometer test. For his lower body flexibility, we're going to be doing a back saver sit and reach. And then for the upper body range of motion, we're just going to do a back scratch test. Again, really not doing anything too intense, just because he's just got at that 12-week point in which he is able to engage in those upper body exercises. So his exercise prescription is based off of what the ACSM recommends for patients with his condition. The frequency for his aerobic training is 4 days per week. The range ACSM recommends is 3 to 5 days per week. During his outpatient work, he's been doing 3 days a week, so we want to progress him to that 4 and eventually to the 5, but starting out we want to have him at 4. The intensity, we can't use heart rate to measure intensity, so we are going to use a rating of perceived exertion from 11 to 14 on a 6 to 20 scale. The time, he should be progressively increasing from 15 to 20 minutes per day to 30 to 60 minutes per day. And then once he gets that down, then we can move to that 5 days per week. And type, he can be walking outdoors, he can be walking on the treadmill, stationary cycling. For his resistance training exercise, we want to see him doing 2 non-consecutive days per week. For his intensity, we want to slowly increase upper body exercises over weeks to months from 40% of his 1RM to 70% of his 1RM, and lower body exercises should begin at 50% 1RM. We want him to perform 2 sets of 12 repetitions of all of his exercises, and exercises that he can perform, weight machines, dumbbell exercises, and elastic band exercises, along with body weight exercises. His flexibility training, he should be doing this daily, where he's stretching to the point of feeling tightness or slight discomfort. He should be holding those static stretches for about 10 to 30 seconds. And then for his dynamic stretches, I always say it's a good idea to get about 10 to 15 of the dynamic stretches in, but that's just me personally. And then he should be doing all of his stretches for about going through them 2 to 4 times every single day. And then here are the references that all of this case study has been based on. And thanks for watching.